Today, I'll start off with just a few updates on the COVID-19 cases and trends we're seeing, and then I'll take any questions you have, as Sarah mentioned. We're currently in another wave of COVID cases in our community. This is not unexpected as we've come out of the holiday season. As we know, people have been traveling and getting together in groups indoors as we do during this time of year. People are taking fewer precautions against the virus, and there's waning immunity from natural infection and vaccination. So we anticipated this would be the case, and we're not surprised by it. At Novant Health, we're currently caring for about 260 COVID patients in the hospital across our healthcare system. It's a combination of those who have active positive COVID infection, those who are still recovering, who are no longer contagious. So the last time we spoke in early December, we had a little over 100 patients. So it's been a steady increase over the last several weeks. I do get the sense that we may be kind of peaking right now in the post-holiday numbers, but we'll see how that goes over the next several days and weeks. The average age of a patient in our hospital with COVID right now is 70 years old, and the vast majority are not up to date on their vaccine series. These patients often have other medical problems, including diabetes, as well as heart and lung disease. So as has been the case through the entire pandemic, this virus is disproportionately affecting older, more vulnerable patients. Proportionally, we have fewer patients in the ICU or on ventilators than we had earlier in the pandemic, suggesting that recent variants are not more severe in the clinical disease they cause, and that the population has developed some degree of protection from severe disease through previous infection and vaccination. Older individuals or those with health conditions should consider their risk of infection and use caution around large groups of people or those who are ill. They should also speak to their physician about treatment options if they develop symptoms of COVID. CDC data shows that the rate of COVID-related hospitalizations in unvaccinated adults 65 years of age and older was 13.5 times higher than those who received a bivalent booster. And those who've been vaccinated but had not yet received the booster were 2.5 times more likely to be hospitalized.